Okay, let's dive into one of the most, well, dramatic and time-sensitive emergencies in all of medicine. We're going to talk about what happens when the body's main pipeline for blood, the aorta, fails, and I mean catastrophically fails, from the inside out.
Just try to imagine this for a second. A pain so sudden, so overwhelming that it feels like something is literally tearing you apart from the inside. That's not just some dramatic description. That is the classic, terrifying alarm bell of an aortic dissection. It's the sign that a major crisis has just kicked off.
And this number, well, this represents a terrifying countdown. We're talking about the most dangerous type of dissection here, where the risk of death jumps by 1 to 2% for every single hour that treatment is delayed. The clock is not just ticking, it's screaming. The stakes, they couldn't be any higher.
So yeah, this is a true ticking clock emergency in every sense of the word. Let's get right into it and look at exactly what's happening inside the body so you can really understand why every single second counts. All right, so how does the body's largest, most important artery actually come under attack like this? Let's break down the mechanics of this total catastrophic failure.
Okay, so here's what's happening. The main artery leaving your heart, it's literally tearing apart, but from the inside out. You've got this high-pressure blood that starts carving a new path between the layers of the artery wall. This creates what doctors call a false channel. And the big problem is, this new channel can actually squeeze the true one shut, which, as you can imagine, cuts off blood flow to the rest of the body.
Now, to really get what dissection means, you got to know that the aorta is built with 3 distinct layers. So the whole problem kicks off with a tiny tear in that smooth inner layer, called the intima. From there, blood forces its way into the middle layer, the media, and just starts splitting it apart, like peeling an onion from the inside. And all of this is being barely held in by that thin but tough outer layer. And this chart, this right here, shows the single most critical distinction that doctors have to make. And you know what it all comes down to? Location, location, location. If you have a tear in the first part of the aorta, right as it leaves the heart, that's a type A. It's an immediate lights and sirens surgical emergency. But if the tear is further down, a type B, doctors can often manage it with medication. That one single detail, where the tear is, changes absolutely everything.
Okay, so we know what it is, but how would you, or more importantly, how would a doctor even begin to suspect this is happening? Because the signs, well, they can be super dramatic, but they can also be really deceiving.
Yeah, the symptoms are all over the place. I mean, besides that classic tearing pain, a dissection can literally starve your organs of blood. That can lead to things like fainting or even full-blown stroke-like symptoms. But the most unique clue, the real telltale sign, is pain that moves. It actually migrates, following the path of the tear as it rips further down the aorta.
And here's a really specific sign that doctors are trained to look for. A big difference in the blood pressure readings between your left and right arms, say more than 20 points. What does that suggest? That the dissection is blocking blood flow to one of the arms. It's kind of subtle, but it's a super powerful clue that something is going very, very wrong inside the aorta.
So once a doctor suspects it, they have to confirm the diagnosis, and they have to do it fast. That means advanced imaging. And the undisputed gold standard, the one used in about 75% of all cases, is a CTA scan. It gives this incredibly detailed 3D view of the blood vessels and can show them exactly where that tear is. All right, the diagnosis is confirmed. Now, the patient's treatment goes down one of 2 very different paths. But the immediate goal for both, it's exactly the same. Do whatever it takes to prevent a catastrophic, fatal rupture.
So for that type A dissection we talked about, there's no time to waste. The patient is rushed straight to the operating room for emergency open-heart surgery. I mean, we're talking surgeons have to physically cut out the torn section of the aorta and replace it with a tough synthetic graft, all before that weakened artery wall gives way and ruptures.
But for a stable type B dissection, the whole game plan is different. It's not a race to the OR. It's a focus on damage control right there in the ICU. Doctors hit the patient with powerful medications to drop their blood pressure way down and to soften the force of every single heartbeat. The goal is pretty simple, really. Just take all the stress off the aorta, stop the tear from getting any worse, and give the body a fighting chance to stabilize it. Now, surviving that initial event, that's an absolutely incredible feat. But it's really just the beginning of the journey. This isn't like a broken bone that just heals and you forget about it. Nope, this becomes a lifelong condition.
See, the aorta is now permanently weakened. It's compromised, and that leads to a pretty sobering reality.
About 1 in 3 survivors will end up facing another major complication or even need another surgery within just 5 years. So you can see why this demands constant vigilance.
And this is what that vigilance actually looks like in practice. It means a strict, lifelong schedule of follow-up scans. We're talking at 3 months, then again at 9 months, and then every single year after that, for life. Doctors are basically keeping a constant eye on the aorta, looking for any sign of dangerous swelling or new tearing.
You know, this quote from the research just sums it all up perfectly. It's not some one-and-done event that you just recover from and move on. No, it's the start of a whole new chapter in a patient's health story. A chapter that's going to be defined by really careful management and constant monitoring.
And all of this brings us to what might be the single most important takeaway from our whole conversation. The #1 risk factor for this absolutely devastating condition, you ready for this? It's high blood pressure. It's found in up to 90% of patients. And here's the crucial part. Since hypertension is manageable, just knowing this, understanding this risk, that is the first and most powerful step you can take to protect yourself.